It's yeah,
Well,
it's
like,
1:30 right now. It's 1:10 for Eastern Standard Time. I'm on Central Time.
Okay.
All right. Everybody, we are back live again. Sorry for the slight interruption. We are talking, well, our group of panelists, a very good discussion about racism, colonialism, and slavery and its impact on the Black mental health. We just were leaving off with Future Kane. She was on the stage presently just talking about this issue here, not this issue, but this information that we have that we're sharing with our audience. Future, if you wouldn't mind just stepping back onto the stage and picking up where you left off.
Okay. Hi. Sorry for the interruption, everyone. What I was saying is that I currently sit as the statewide project coordinator for a center that we just opened here in the state of Wisconsin. And as the statewide project coordinator, our center offers 2 lanes to implement systems in the K-12 school districts, and that's for public, private, charter, and tribal schools. And the 2 lanes in which we focus are the social emotional learning, in addition to mental health. What mental wellness is what I like to call it. So I say that it's pivotal and important that our schools have that. One, because Wisconsin in the United States of America is continuously rated the first and second worst places to raise a Black child. In addition to large continual disparities in regards to academics, suspensions, expulsions. So that's continual, and the data hasn't really changed. We've been affected time after time. It doesn't matter what your income level is for the parents and where the children reside. If they are Black, they are still continuously looked at as very different data-wise in regards to the academic excellence that they can achieve or not achieve. So I say that we do have to look at our education systems because, and not even K-12, I am adamant about speaking about early childhood and in homes, because that is where all of this begins. The intersectionality and understanding who a child is, who other children are, what they bring to the table to feel seen, heard, valued, and loved and accepted is very important. And as you spoke about, Dr. Bruce, the fact that the curriculum, a lot of times, if you can't see yourself, it's really hard for a student to believe that they can achieve. And I can only speak to my personal experience. K-12 I went, not one. I didn't see not one Black teacher. And yes, wow, you're saying wow over there. I see you. Wow, that's what I said too. And then I was blessed with beauty when I had it, that my undergrad experience. But the reality is that does something to your psyche. And we're talking about the unconscious bias then that you form thinking that I don't know, I don't even see myself in posters. I don't see myself in books. I don't see myself celebrated on every day. And I'm not just talking about in Black History Month. I'm talking about in all History Month, which is every month that every child is in there. So yes, it is very important for me, and this is my mission, to help educate children and to have children see me, because in the United States, the last data that I had looked at was 80% of our school population is white. Now, I'm not saying there's anything wrong with white teachers. What I am saying is it needs to be diversified, because for you to be culturally sensitive and culturally competent to other cultures, when 80% of our population in the United States of adults doesn't even have a Black friend, it's hard for you to understand that culture and then integrate it and embed it in all that you do. So that's the education realm in which I will speak for K through 12. It's a little snippet, but obviously Wisconsin is a huge data point for the United States of America in regards to the disparities.
Yeah.
I recall, oh, I'm sorry, go ahead.
No,
all right.
Go.
Can I go ahead? All right. Oh, thank you very much. I've just been enjoying the conversation since, and I've learned so much. As the only remaining male on the panel, while we're waiting for Kevin, the maybe is an opportunity to wish you guys happy International Women's Month. Beautiful, strong women on the panel. You guys are gorgeous role models to everyone watching and listening to us today. Dr. Bruce, I really share your point when you're talking about mental health in the UK and how the Black community do not really trust what we refer to as the system in terms of accessing services. But I'll take it a bit back, and a big thumbs up to Angela for also sharing her story and I experienced that was very inspiring. And I'm sure your recovery process continue, and I wish you all the best for the future. I just want to take it a bit back to uh, mental disorders and what we call the etiology, basically. And I like talking about the biopsychosocial model, how the biological factors, the social factors, and psychological factors all are contributory factors. And there's no way we can talk about it and not refer to racism, colonialism, slavery, how these historic things has affected us and it's still affecting us today. And it's a little wider impact on how people, how we perceive ourselves. A lot of people, how what they think of themselves, self-esteem, and in terms of you at the future was just talking about not seeing a black kid there. You know, Dr. Bodo was talking about how people would call the white colleagues or a doctor and would refer to you by their first name. So it cuts across all sectors, and the way individual reacts to this vary from person to person. And I might be able to tolerate it. I'm not saying it's a good thing to tolerate, but some other people can break down from these experiences. So I think Kevin did a good job giving us an idea of what the background is. A lot of us here, we've talked about what the current situation is. I think we have the skill set amongst us. Look at, I'm just seeing doctors, I'm just seeing professionals everywhere on my screen. We can make this change. You know, we can influence things, and that is the vibe, and that is why I got involved in this Black Mental Health Matters. That we really have what it takes within us to change the narrative. You know, we're not going to wait for these people or anyone to change it. We have to take the bull by the horn, and we have to make that. And I'm glad that all of us on this panel, we are on the same page and we're driving for that change. And I'm going to just sit down and continue learning from you guys. Thank you.
Thank you so much for that, Dr. Oluwakere. Very powerful words, and thank you for also acknowledging our women panelists as we're moving to women history, our acknowledging of women. Did Dr. Golden, she chime in before we were interrupted? Because I wanted to hear from her as well.
Myself?
Mm-hmm.
Yes, well, I was thinking about so many things. One, I was thinking, Angela, the lived experience of mental health, that's so powerful, because that journey can inspire others to think, I can get through this as well. And then it made me think about academia, and, you know, even there's less than 1% of Black professors female within academia. And so, you know, when we talk about if you can't, you need to see it to be it. And I think, Future, you were mentioning just your presence as a Black woman in this space will make people think, well, I want some of that as well. But for me, I think about the journey and also the support that others behind us, you know, that it's about looking back and supporting those who are traveling that same journey. And so whatever we've experienced, the difficulties in how we view ourselves. So everything that was talked about with regards to the doctorate and learning and putting your heart and soul into this piece of work and this study over years. And then sometimes, you know, I came away asking more questions like, what was I chasing? You know, because it was all the way, it was like going up a mountain. And then I felt deflated. And that was my honest feeling because of the constant battle with the microaggressions or did I really hear that or what? And I'm spending that energy trying to decipher the meanings of conversations or the expressions of faces that can just, after years, that can just really grind you down. And so, you know, it's great to have people around me like myself that I shared and talked about my journey. And I think that's what built me up to see value in myself and also exercise self-compassion to myself, because so often we're on ourselves, we have high expectations, and sometimes that pressure can really, we're not looking after ourselves as we should. And that's why I think, you know, self-compassion to ourselves, like holding a baby as if that's us, how we would look after ourselves. That's what we need to, for me, that's where I'm at now, that I have to give myself that space to make mistakes, but also be self-compassionate to myself. I think that's so important for mental health as well.
Thank you so much, Dr. Bruce Golding. I want to open up this question starting out with Dr. Boudreau. But before I get to that question, just for the people who are commenting, we will have some moments where you all can ask our panelists questions as well. We want you to be active and engaged. So if you have a question, put them in the comment box and we will bring them up on screen. That way we'll read them and our panelists can address them. But Dr. Boudreau, the question that I have for you, and you just kind of starting this off, do you think it is important for African people or Black people of African descent to seek out other Black healthcare professionals to work through trauma, to work through slavery, to work through the impacts of oppression in order to heal?
That is such a difficult question for me, and I'll tell you why. When I was in practice, I said, I can help anybody. So I didn't want anyone to not feel comfortable coming to see me who wasn't Black. And so I said, well, if that's the case, then I don't want for Black people to not feel comfortable going. I did my residency in Montana. So let me tell you, I was the only Black person there, and I wanted my patients to feel comfortable coming to see me. But there's something to be said about understanding how we present. Dr. Harris talked about the work that she's doing around developing a culturally competent tool. And I'll tell you, the biggest fight I had in my clinical training was around the Rorschach. And I said, you make me assign pathology and you don't even consider a person's culture. And so something that they said that might be just a cultural norm is deemed pathology in that book. And there's no way for me to reconcile that. So my professor and I would have very heated debates in the middle of class because I was the only person who even recognized the things that were being considered pathology. And then how do I go and integrate that into this report because this book says it's pathology? When I think about my patients in the hospital, and I think about the work that we've had to do around some of the different medical illnesses and how that presents and what it looks like. I think about a child I worked with who had type 1 diabetes, who didn't understand the difference in their diagnosis and grandmother's diabetes. You know, grandmother has type 2. What does that mean? And my ability to sit and understand why you're not taking your insulin because you're frustrated because you were told you have diabetes and you don't want to have this restricted diet that grandmother has. And your physician, your endocrinologist, didn't understand the importance of food in our culture. So where I want the world to be is where individuals understand culture in the context of healthcare, mental and physical. If your provider, be it a psychologist, a psychiatrist, a primary care physician, your obstetrician, your gynecologist, whatever doctor you're seeing, if they don't understand you and you don't feel heard, it's important that you find someone who can hear you and understand all of you as you are seeking care. So I feel that was a long way to say, I bring culture into my care. I won't say that no white people do that. I'm saying you have to find someone who understands your culture because that's critical. That's just as important as any piece of criteria in our diagnostic manuals. So can I say yes or no?
Can I just chime in?
Come to the stage and piggyback off of anything Dr. Boudreau.
Yes, can I chime in? Dr. Boudreau, what you were saying about the tests, this is very critical. You know, when we were students, we really didn't have the opportunity to say no, because this was part of our training. And so now as professionals, you know, there was another test called House Tree Person, and I used that, yes. And if I drew a picture, I would be, have some type of pathology. Is the worst test, no validity to it whatsoever. I after a couple of years of using it as a student, I said, what is this? This has no validity to it whatsoever, including the Rorschach. Some of those projective tests that we use are just not for the kids that we work with. It's just, they will come out looking like all kinds of pathology, and it's just not appropriate. So I totally agree with you. This is what the concern I have is when using, and this is why I put a disclosure in all of my reports saying this is a snapshot of a student's intellectual functioning or academic functioning just for that day. We have to look at the entire profile of that student, because if we don't, all of these kids will be labeled as emotionally disturbed, and emotionally disturbed is under IDEA. And that's unfortunately a lot of these kids in the school systems, especially Black boys and little Black girls who have some sort of trauma, either it's vicarious trauma or direct trauma, they often get labeled with ED. And so this is a huge problem. I remember just one case I had when I was working for a school system, and my supervisor said adamantly, this kid it was only an isolated incident. This kid has ED, he's ED. I took on the case. I spoke with the parent, I spoke with the school. He was not qualified. And the parent was like, yeah, I thought so. He's really smart. I don't understand. And so I did not go that route. It was inappropriate for that kid. One isolated incident, and you're labeling him as ED. So this is a huge, significant problem that we have. And I am glad that I'm able to do this on my own, having my own practice and educating parents and staff at schools on, the appropriateness of classifications and the labels, what they can do to children. So that's just my piece. But in terms of the question that you had, Misha, in terms of looking at going to Black professionals or psychologists, so it's like, in my studies, if someone from another culture is culturally competent, it's called an autonomous clinician, and they are well versed, they're educated, they understand the culture. That's okay, if they can, understand where you're coming from. I'm first generation Haitian American, so I can, from that standpoint, I can understand the American values, but I also am, a child of an immigrant, of immigrants, and so, coming from that, I see both sides. Students coming here, and also with the whole testing and evaluation, they're not speaking the language, they don't understand the culture, and then they're identified as being intellectually disabled. How can you do that to a child when he or she hasn't really learned the culture or the language? It happens a lot in the Hispanic community as well. They haven't even given the chance to proceed through the English language courses. They automatically say, oh, well, they have a learning disability. Even my own sister, she only knew French. That's it. Going to school in the kindergarten, first grade, she was labeled as having a speech deficit. So these are the kind of issues that, we as, clinicians, professionals, leaders, people of color really have to, look at and come together and figure out a way to, to decrease the labels, to try to get staff, parents to understand, what we're doing and how we can help. Workshops, consultation, things like this, is very helpful.
Dr. Harris, if I can talk about labeling someone because they have mental health disorders, should I assume that people, because they fear to be labeled, does that make them fail to go and get diagnosis and treatment from hospitals because they fear to be labeled in case they have the mental health disorders?
So in terms of hospitalizations, the one thing about clinics and hospitals, they diagnose you within 20 minutes. They look at the DSM and they say, you meet this criteria, this is what you are. So that's another issue with the hospitals. And I mainly work with the school systems, but that's another issue too, is just the, meeting the criteria on that first visit and then just being labeled right then and there with depression, bipolar, schizophrenia. And again, it might be trauma, environmental trauma that has caused this person to act a certain way. So this is problematic in the school systems, in hospitals, psychiatric, inpatient, all around. It's an issue.
And I'll tell you, when I was in practice, we often were brought in to look at assessments. And I thank you because there just weren't enough people who specialized in assessments. And so if you don't understand, so I thank you, Dr. Harris, for your work, because there's just not enough of you. So one thing we saw was there are, for some, there's resources that accompany some diagnoses. And so there's this, back when I was in practice, you also had the issue of how the standardized test. And so to not put any particular district on blast on this session, if a school wanted to make their testing scores look a certain way, because those children in special ed don't count against their target, right? So the school looks a certain way. So you try and get as many kids a label so that those kids are weeded out of your scoring, so that there's a smaller population that's being held accountable. So there's so much, and that's why I say I left practice to go into the policy, because this is the stuff when the school says we want to test. Now there's some things, and some states don't allow special ed to be removed from the population, but unfortunately I was in practice in a place where they were. So the special ed population was very large, so that those kids weren't counted and the school had resources. You cannot take, and unfortunately, you asked about, can you go and get care? Let me talk about access to care here in the United States. It's a problem. And so just because you have a diagnosis does not get you access to anyone, and certainly not a psychologist. So you may be able to see the school counselor, and this is I'm not dismissing school counselors, but their training is not mine. You may be able to see a district psychologist who doesn't understand you, who's brought in when there's an emergency, but regular, consistent care, you don't get it. And so we have a problem here that I can, again, I said in the beginning, my lens is here in America. We have a problem here with access and how mental health is viewed as a necessary part of care delivery. Having a diagnosis does not get you care. I'm a 2-time breast cancer survivor. There's not anything that I can't get around a mammogram. So I don't have the same requirements for mammograms. I didn't have to wait till I was 50 because I was diagnosed in my 20s. So I was able, after I fought the fight to get the mammogram, because in their mind, I was too young, but I didn't have to wait till 50 to get the second mammogram. But having a mental health diagnosis does not automatically get you care. And that's a problem we have here.
For our panelists, what is that like in Germany and also in the UK? Can you all chime in on the healthcare systems?
So I can add, because I work in the community as a consultant psychiatrist, and among the Black and minority ethnic group, there is the stigma is still there. People are not really willing to come forward to access service or even engage with the services, just because they think various decisions will be made based on the fact that they suffer from their from a mental disorder. And back to what Claire was saying earlier, that because they will be labeled, the fear of being labeled prevents them from accessing the service. If you've got your papers, you're legal immigrants in the country, you should have access to the NHS, and the NHS has got structure whereby most treatment is available at the primary care level, which is the GP level, and then if you then require further specialist care, that's when you send it to the secondary care, which are the specialized mental health services. Most depression and mild cases of stuff like that could be managed within the GP level, and access is fine once you have your right to stay in the country. But if we now go to narrow it down to the Black and minority ethnic group, the problem here is the culture, the faith, and all those kind of things have influence on them accessing services. So it's a bit difficult. That is why we need to continue to do the awareness, doing these talks within our community. And our community, I mean, churches, mosques, and gatherings, local communities of organizations. So we try to get there and speak to them that they should try and come out and not suffer in silence and engage mental health services. And I do agree as well that once a few diagnoses that are made when patients are in inpatient setting is probably might not be extremely accurate, because as Dr. Masha was saying, it's just probably tick, 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 and it fits the criteria. And it is when they now come into the community, when you see them over a period of time, and then you review a lot of other aspects of their life, and you might see, oh, it might not actually be this, it might just be due to trauma or whatever that has happened in the significant life experience. But in the inpatient services, there might not be that, there might not be time. There's blood pressures. They just want to get you back out there. So all those are factors that could affect accessing service. I don't know if Dr. Bruce wants to add to that.
Yes, I think, yeah, I agree with what you said. And I think even when we look at the diagnosis of special needs in the UK, Black children are twice as more likely to be diagnosed with a special need. But whether and then in that time, there are high exclusion rates. So they fall off the system. And, many studies have been made about the prison, say the school to prison pipeline, that, the support isn't there. And, we can see from the youth offending rates, or the children, young people that go into crime or have communication with the prison services, this then leads into, if we go back, you can see that their schooling, there's been issues with education from a young age. So even with diagnosis, like you said, I think, some Black families in the community, there is that stigma, and there's that lack of trust, or, that sometimes from their own experiences of school. And so, I can't blame that lack of trust. There has to be that that coming together to understand how that support can be personalized for that young person or that child and their families. But yeah, and it goes back to race again, and the experiences that families have experienced. I remember when my parents came over to the UK, they talked about their experience, and they almost gave me a roadmap of how to behave. Don't do this, don't do that, do this, go through this way. That was their way of giving me some of their power, because they knew that within their roles they were powerless. So I think it's sad, because there's a generation of scientists and intelligent young people who are being failed within the education system, and just even time away from mainstream schools. I mean, there's challenges all over education, but just that exclusion prepares them for, I'm different again. My color is different, my brain's different, I'm not bright, I'm worthless. And then you get, there are many children that I worked with who were being groomed, and they found a belonging in the street, because they were accepted, they were looked after, and that's what they want. School needs to be a place where a young person belongs or feels like they belong. If you are going to a school and, like someone said, that you can't see yourself represented as a teacher or on the walls, or then you're already in a space of exclusion. And so it's a challenge. But the fact that we're having these discussions now, and everyone's doing their part. It may feel small, but there's a ripple effect of us doing what we can do to make that difference to others.
Absolutely.
Thank you so much.
Okay, go on. You go on. Go on.
You've talked. You've discussed a number of issues regarding Black Americans, people who are living outside Africa, how they are. But I've not heard anyone discuss about disability. How about the disabled? How are they finding it easy or hard accessing all these services, despite them being different from the rest of the community? Maybe Dr. Harris can take it on.
Can you repeat the question?
Yeah, I was asking, how are the disabled people being treated in the different communities that you people are living in? If it comes treatment, if it comes mental health, how are they being received? How are they being cared for in the different communities?
One of the biggest issues that is happening in the schools is that there's a process before a child is identified with some sort of disability. It's called RTI, response to intervention. And one of the biggest problems is that that's not happening in the schools. So what happens is a parent or school determines the child is struggling, and then they're labeled. Instead of going through the process of interventions and putting things in place, whether it be behavioral support, whether it be academic support, having them, access different interventions online or one-to-one in person, they're quickly identifying the kid with some sort of disability. And that's a problem because a lot of times younger kids, especially between 7, 0, and 8 years old, there's a lot of growth that happens during that time period. And so, if interventions are put early enough, these kids can close the gaps. They can close the academic gaps, behavioral support if it's a behavioral issue. And so that's one of the biggest issues that's not happening. And I have encouraged teachers, I've, given them, tools and said, okay, well, this is a tool you can use in your classroom. One of the biggest problems is the schools cannot or will not pay for these interventions, and they can be very expensive. Like Wilson 180, iReady, these different tools that they use in the educational system. They'll have some grades have these interventions, other grades do not have them, and teachers are kind of, at a loss of what to do. So that's one of the biggest issues. I wouldn't say they're necessarily treated differently. They're just kind of put in compartmentalized. And so that's one of the biggest issues too, is that, okay, you can't do the work, let's put you in this corner. But even when they're labeled and in special ed, they may not even get the services then, the support they need. That's another big issue. Is that you have teachers who just don't know how to implement them. They don't have the tools to implement them. So these are the challenges that I see all the time. And I just want to say one thing about just resources in general, just working with the inner city schools. I've worked on both sides of the river. And people who are familiar with the DMV, you have the Anacostia River, you have, affluent on one side and very low on the other, okay? So just in terms, I've seen it all. I've been to a majority of the schools in DC. I've done assessments in non-public, public, religious schools. And just to see in terms of diet, I went to a school in Upper Northwest and I saw a man pushing a cart with fresh fruit. This is an affluent neighborhood near Chevy Chase, pushing a cart, fresh fruit, bananas, apples, gave the kids the fruit. They went out to recess. On the other side, in the inner city schools, I'm looking at sticky buns that the kids are eating for breakfast, mystery meat on their trays. So that's another problem. If the kids aren't, having an appropriate diet and they're eating sticky buns for breakfast, they're going to be hyper. They're going to be impulsive. They're not going to want to pay attention because that's way too much sugar to give a child. So these are the other problems that we have as the resource. I think within the last 15, maybe 10 years, the mayor, made it mandatory that the kids in these, schools are going to get, a healthier diet. But this is only within the last 10 years. I mean, what about before that? What was happening? So these are a lot of challenges that, we're having with our community. And even when I do assessments, especially with the little kids, I bring healthy snacks. And I say, okay, we'll take breaks. And then you can have this healthy snack. And they're not even familiar with some of the stuff that I bring. They're like, oh, that doesn't look good. And then they have it like, oh, this is great. So, I try my best in all ways to try to make an influence and impact on all the kids that even if I work with them 1 time, 2 times, maybe 3 at the most, I really try to make my presence known that yes, I made it and you can too.
Thank you so much, Dr. Harris. I really want to also be conscious of time. We are at, well, for individuals, we're a little bit over time. Everybody's on different time length, but for our Eastern Standard Time, those who are in the U.S., either Central Time, we are at 1. Let's see, I think I'm at 1 or 12:45. You all on the East Coast are going to be at 1:45. So if you have to leave, we understand. But if you can stay on for a little bit longer, then go ahead and stay on. My next question is for all of you panelists. I mean, number one, we have many educated people, thought leaders. We have professionals here. And when we talk about colonialism and structures of education, even do you think how we learn it has an influence in from colonialism, if that makes any sense? Our structures of how we learn in accomplishing these goals or accomplishing furthering your degrees, but having it from a Eurocentric kind of lens. How do you move forward or go about that when the learning system has some effects of colonialism?
So I'll start. I think about my personal experience of needing. I'm hands-on, so looking at. I struggled in the histories and humanities because I need something I can touch. So you give me a 3D model of a cell and I can see it and I understand it. So I was the super nerd in school. I loved science because I could touch and see it. And so if I had a teacher who could let me touch and see and try different things for me without labeling me, because I can't just read a text and get it. So I did better when I had teachers in grade school and in college that allowed me to see things. I think about exams. I don't do well on multiple choice. I am a storyteller. I am a storyteller. So I need to explain to you what I'm thinking. So I can't put it in an A, B, C, D. I don't do well on multiple choice. And so when there is opportunity to show different types of your understanding and present it in different ways, I think we have success. So where some of our children struggle is they are forced into this little box of a multiple choice test, read this textbook and get it. We've moved beyond, again, I'm going to be very US centric, forgive me, but we've moved beyond training. So it used to be people went to school to learn how to teach. That's not the case. When we started having problems in the economy, people said, oh, I guess if nothing else, I can be a teacher. And so you're a biology major teaching science. You might have passed biology classes, but you have no clue of how to teach it. And so people stopped learning how to teach and learning how to make something make sense. So I don't know how to help you understand the cell, but I understand it. I should not teach you, but I can go and manipulate it. And so that's where we struggle. We don't have, I think, number one, we don't have the same level. People are not trained to teach. They are trained in their area. And they don't know how to do things outside because they're not trained to teach. They don't know how to do things outside of a textbook. And so it becomes a challenge for someone like myself who was told I would not go to college and that I was literally told that in high school. I wouldn't be successful in college. And I'm one of, I'd say maybe 15, 20% of my class completed college, and I probably could count on my hand the number of people who went on to grad school. but I was told I wouldn't make it because I don't do well on standardized tests. And so when it came to the MCAT, when it came to the GRE, when it came to my boards, all of those things were difficult for me because I don't do, but on my written and oral boards, I was great because I can talk and tell you a story. And that's where we struggle, is not having multiple ways to assess. So I think if we can get to a place where there are multiple ways to assess and multiple ways to give the information, our children will do better.
Thank you so much for that, Dr. Boudreaux. I don't know by show of hands who had, someone in school at their early primitive ages tell them that they couldn't go off to school. And here you are, holding your doctorate, which goes to show, it's not the child or the student, it's just finding that curriculum or finding that what branches, how they are a learner, if that makes any sense. Because I know for myself, I'm also a hands-on learner, a visual learner. And because of the way I process things, I was too told you couldn't go on to college, you couldn't go on to do these things. And that's absolutely not the case. So thank you so much, Dr. Boudreaux, for being very transparent and open. And I hope our viewers can see that, again, we have an amazing group of panelists, and despite those odds, have been able to overcome. I also want to just do a kind of a roundabout, let everyone hit on some topics if they haven't spoken just recently yet. I know we haven't heard from Sister Oluratoya in a while. If you want to just jump onto the stage really quickly and just chime in and give us your thoughts. And unmute your mic for a second because we can't hear you. We want to hear all the lovely things you have to say.
Yeah, I totally agree that there have to be a multiple perspective on what learning is or what education is. So at the moment, if we go from the Eurocentric perspective, it is rather exclusive. And it is very individualistic, and not so much as what education is, what values are that will benefit the collective and the community. So here, for example, you have often that children are being labeled and excluded. Like I said, a lot of these methods are also structural. So you have a child failing an exam because they say what belongs together, a teacup and a saucer. Now this is a child whose parents are undocumented, and she has a teacup, but she doesn't have a saucer. So you have already there some kind of exclusion that often certain kids are not promoted. They are immediately labeled and left behind. At the same time, here in Germany, there is a very strong institutional racism and structural racism, where you have children who, even when they are excelling in school, as a reason of their culture, they are being excluded. So she has all the grades, straight A's, but she's being excluded because she's said to be an introvert. And this is now a pathology stuck on her. So like certain cultural attributes, like looking down when the elders are speaking, are seen here as pathological. The child must be harmed at home and is so intimidated, she doesn't look up. And we have this kind of ongoing situations that affect the children here, that racism and colonialism are not addressed in the educational system, that Black children are often isolated in the classroom, being the only one or only two, where in comparison to America or to England, there is at least a greater sense of belonging because there are others more. And yeah, I would like to really come back again to this importance that the community can play when we talk about healing, when we start to look at cultural, how we can restore certain practices that will enable self-determination. Because often what happens is one realizes that the system is just not made for certain groups of people like ourselves. And in this aspect, it is also, one comes also to the question of justice. There's the question of justice, not only also in the medical field, racial justice in all these areas. We have the case of a young brother, Brother Tunum Bobda, who was admitted in the university hospital and had developed an allergy to medication. His younger brother had died 3 years prior to his crisis, to his mental crisis from an allergy. And the doctors refused to listen to him or even to understand or to try other methods apart from forced restraint and medication, so that patients here, psychiatric patients, are often over-medicated. And of course, for a therapeutic process to start, there needs to be trust. And there already there is a failure because there is no trust built. So you have patients who go to therapy and just sit there. And when they come back, they say, I had nothing out of it. So these are some of the situations that describe the situation here in Germany.
Yes, I think just to follow on from that, who can relate to that in the UK, the challenges, it's made me question, if anything, when I think about education and colonialism, it's made me ask more questions like, you know, whose worldview am I presented with? Whose eyes am I looking through? Does it relate to me? You know, even looking at psychology, who am I learning about? What about the East? What about African psychology? Why are we not getting a holistic perspective? You know, and so for me, it's been about asking questions. What are children being taught at school? How do children feel about what they're hearing? Because it's going in and there's a message going into them, but for the reasons which we can go back to colonialism, that is, you know, that your value, know your place in society. You are
exactly,
you know. So I think
exactly.
You know, you've got community things like Saturday schools, and the community can come into place to try and fill those gaps of the lack of confidence within a school classroom if a young Black person feels out of place. And I think the community now, we're at a stage where the community can be starting to embrace and come together and say, well, how can we help our young people in the community through music, through creative expression, through things that help them to shine? Because I'm a hands person. I do sign language now because I can't help. I like to use my hands to communicate. But it's funny, I'm just diverting, but I remember I was in an interview and the head teacher kept on looking at my hands every time I was using my hands. Her eyes would go and look at my hands, and I thought, gosh, it made me feel a bit self-conscious, like, am I doing something wrong? And I remember speaking to my sister about it, and she said it could be seen as a threat, so just keep your hands down. And I thought, really? And I just thought, well, I'm going to learn sign language because I'm not going to change this. So I think there's a lot that has been mentioned today, but it goes back to that lack of value, not being seen, and that lack of belonging, which is at every level.
Thank you so much, Dr. Bruce. I think we should finalize and end the session. It's getting to 9 p.m. here in Uganda. It's African time, so I think we should have the last words from each one of us regarding our topic today, racism, colonialism, and slavery. And yeah, we end it because it's really getting so late. Angela is complaining. we should finish up. So maybe we should start with Angela. Your last words regarding today's topic. Angela, can you hear me? Well, as Angela's network stabilizes, maybe we can start with Dr. Harris.
I just want to say it's a pleasure. This was an awesome experience. It was a pleasure to meet all of you. I look forward to seeing you all again and doing more of these. I think this is very, very important. I can share with Dr. Bruce, Dr. Boudreaux, all your experiences just in terms of telling me that I can't do it. You know, it's too hard. You know, and so I didn't even have those role models, you know, growing up. My parents work hard. They were immigrants. I didn't have anyone to look to say, okay, well, I want to be like that person. There was no presence, someone looking like me. So I just pushed through. When someone told me no, I said, yes, I'm going to do it. So to prove myself, to prove that to that person or other people that I could do it. And so that's what pushed me to keep going, keep going, keep going. And I just want to say that, you know, we all have to keep going. And this is an amazing session. And I look forward to working with all of you and seeing you all again. Thank you.
Thank you. Dr. Boudreaux, if you wouldn't mind going.
It has been, I'll echo Dr. Harris, it has been an absolute privilege. I look at the time and I'm like, oh my goodness, we could keep talking about this forever because this is such critical work. And so thank you all for the audience who's been engaged. I know we had some things coming through the chat. I hope we were able to cover and respond to your questions. I'm available on LinkedIn if you ever want to connect. And I look forward to continuing this dialogue because this is not something we can do in a 2-hour conversation. So thank you all. To the panelists, it's been my honor and privilege to serve with you today.
Thank you so much, Dr. Boudreaux. And Angela, last certainly but not least, we wanted to make sure your connection was up to par.
I'm so happy to have been part of this discussion. And one thing that my parting words are, never give up. And like my dad told me, he went home to be with the Lord, but he told me that aim high and fail. It's not a failure, but aim low, it is a crime. So with those words, let's always aim high, never low. It's been lovely engaging. Thank you.
Thank you, Angela. We'll be waiting for that book to drop soon as well. We just want to also just thank all of our viewers. I know we had a few different connection issues a little bit earlier. The earlier broadcast ended, but we thank you for hanging in with us on all the different platforms. I thank all of our panelists again for your time. I mean, we're all over the place again, from Germany to UK, where DC, many in different parts of the world. This conversation was needed, and we can't wait to have further discussion concerning these issues concerning Black mental health. But thank you all so much. And we look forward to our next segment. Thank you, ladies.
Thank you. Bye.